What if I told you there's a treatment for erectile dysfunction with a 90% success rate that works when pills don't? But most men haven't heard of it. I'm Dr. Reena Malik, urologist and pelvic surgeon, and today I'm going to talk about intracavernosal injection therapy for erectile dysfunction. What it is, how it works, who it helps, and why it might be the solution you've been searching for. Now, before I get into it, I have to tell you about my free ebook, which shares my top 10 tips for more pleasure and better sex. Check it out at www.reenamalikmd.com/morepleasure. Now, intracavernosal injection therapy, or ICI, involves injecting medication directly into the spongy erectile tissue of the penis, called the corpora cavernosa. I know, before you guys move away and you're thinking, what? You want me to inject medicine where? Hear me out. It's really not as bad as you think. It was actually one of the very first pharmacologic treatments for erectile dysfunction, introduced almost 10 years before Viagra hit the market. So guys who are struggling, this is one of the most common treatments we used. Now here's how it works. These medications in the injection are vasoactive agents, meaning they relax the smooth muscle in the blood vessels of the penis. This allows blood to flow in and fill the erectile tissue. This creates an erection that's typically firm enough for sexual activity and lasts long enough to complete intercourse, anywhere between 30 minutes or more. The most common medications used are alprostadil, also known as prostaglandin E1, or a combination of formulas including papaverine and phentolamine, called Bimix or Trimix. Now, these work synergistically because they all essentially work together and they're more effective than any single one drug alone. And the beauty of these medications is you can customize the dose to your specific needs and the response that you get from it. And according to literature and my experience, the efficacy rate approaches 90% in men who use it correctly. Compare that to oral medications like Viagra or Cialis, which work in about 60 to 70% of men. It also works effectively in men who either don't respond to pills or can't take them due to other reasons like taking nitroglycerin medications. And this can include guys who have diabetes, cardiovascular disease, or those who've had prostate surgery. So who is the ideal candidate? Well, like pills, like Viagra or Cialis are typically what we offer first. The injections become an excellent option for a bunch of different groups of men. First, if you've tried oral meds and they haven't worked or they cause intolerable side effects, like you're getting headaches, flushing, vision changes, muscle aches, intracavernosal injections might be your answer. Research shows that 88% of men who failed sildenafil or Viagra reported positive responses to intracavernosal injections. Second, men who have certain medical conditions that may have very poor responses. These can include very severe diabetes, vascular disease, or nerve damage, which is often what we see in our third group, which is men who've undergone radical prostatectomy for prostate cancer. And this is because after prostatectomy, up to 60% of previously potent men will experience erectile dysfunction 2 years later due to nerve injury. So in this case, ICI can also be used to maintain penile tissue health. On my last video about preventing penile shrinkage, I talked about what happens when you don't have erections either at night or during the daytime because of poor vascular flow or nerve injury, that you actually lose penile length about 1 to 2 centimeters after 3 to 6 months. And so this is where, if you're not getting any erections after surgery, intracavernosal injections can be helpful. One study found that men using intracavernosal injections 3 times a week for 12 weeks after prostatectomy recovered spontaneous erections in about 67%, compared to only 20% in the observation group, meaning those who didn't do anything for erections. So what I would tell you guys, if you are struggling after prostatectomy, do what you can to get erections early on because it may allow you to have better outcomes in the long run. Now, there are some guys who shouldn't use intracavernosal injections. These include if you have sickle cell disease or other blood disorders, a history of priapism or a prolonged painful erection, serious psychiatric conditions, and if you can't actually manually inject, or if you have vision problems or morbid obesity where you can't really see your penis very well. Now, interestingly, you might think that guys who get good responses from oral medications would never get injections. But when we look at guys who have tried injections and have responded from oral medication, 54% of these guys in long-term studies choose to continue with injections anyway. The reason being they got better penile rigidity and fewer side effects. Now, you guys are all wondering, how bad does this hurt? And this is the number one concern I hear, and of course it's understandable. The good news is that it's really not as painful as you might imagine. In large studies, about 50% of men report some penile pain at some point during the treatment, but the pain only occurred after individual injections about 11% of the time. That means that most injections actually don't hurt. And when pain does occur, it's really mild, ranging from a 2 to 2.4 on a scale of 1 to 10. And only about 6% of guys discontinue treatment due to pain. Now, I'll tell you guys, one of the first times I did this injection to a patient, he looked up at me and said, "Oh, you're done?" And I realized then that this is just not as big of a deal as we make it out to be. The reason this is not so painful is because the needle that we use is very fine, similar to what diabetics use for insulin. And you're injecting at the side of the penis, at the 9 o'clock or 3 o'clock position where there are fewer nerve endings. And the actual injection just takes seconds. And so a lot of guys report it's a lot less uncomfortable than they made out in their heads. Do people continue using this for long term? Well, when you look at long-term studies that have followed guys for 8.4 years, and some of these guys were using injections for over 20 years, patients report that their penile rigidity improved from 41% before treatment to nearly 90% after. Their International Index of Erectile Function scores showed statistically significant improvements across all domains, including erectile function and satisfaction with these medications. So ultimately, treatment satisfaction is consistently high. 88% of users are satisfied, and 94% say they would recommend it to a family or friend. This is why you haven't heard of this. Guys don't talk about their issues in the bedroom, right? They feel like this is not something they can share with other people. But I will tell you from my patients who've talked to me, the ones who do talk about their friends, they're so grateful. Either they heard something from their friend or they helped support their friend during a challenging time. Now, how often are they using intracavernosal injections? They're using it about 4.4 times per month, and 85% of them can use it privately, and they don't need to involve their partner or even let them know what they're doing. Now, what about complications? The most serious complication is priapism, an erection that is painful and lasts longer than 4 hours. And this is a serious emergency. The reason being is that when you have an erection that lasts longer than 4 hours, you're no longer getting blood flow in or out, meaning there's no oxygen getting to those tissues, which then can cause fibrosis and permanent erectile dysfunction if not treated. So if you find yourself in this situation, don't delay at home. Get to the emergency room immediately. Now, the good news is that this only occurs in about 1 to 7% of people who use these injections. Now, if you use Trimix, the rate is a little bit higher than alprazolam alone, which makes sense. There's more medications. However, again, if this happens to you, it is still rare, and just get to the emergency room right away. Now, other side effects are minimal, including maybe some bruising or a hematoma formation, which can occur in 7 to 33% of users, mild penile pain in 12%, penile fibrosis or plaque formation in 2 to 10%. Now, this is something where it doesn't make a lot of sense to me that having this tiny little needle can create a plaque or a fibrosis because it's just very, very small. However, we do see it in 2 to 10% of long-term users. Now, 20 to 27% of men reported some penile curvature or length loss over time. Now, new penile curvature related to Peyronie's disease will cause length loss. So who knows what caused that? The other thing is if you're not getting regular erections and say you're not having enough sex because you only use this once a month or very rarely, it can again cause the development of fibrosis and loss of penile length. Check out my video on penile shrinkage because I talk all about it. And the most important thing here is that you get trained, you do it correctly, and you use the appropriate dosing. So that brings me to my next point. If you're considering doing this injection, here's what the process looks like. You'll need to work with a urologist or sexual medicine specialist. This is not something you just start on your own. Your doctor will, of course, do their normal evaluation, and if they decide that this is appropriate, they'll do the first test dose in the office because we have to monitor your blood pressure and your heart rate and make sure that you don't develop a priapism or prolonged erection. We'll also teach you how to do the injection and how to clean the area, how to hold the penis, where to inject, and remind you of all the things I'm talking about in this video. And a lot of times the reason people aren't happy is because they're not doing it correctly. They're not injecting the needle far enough in, and so they don't get the response because they're not injecting it into the corpora, or they're getting some swelling of the penis. And so it's important to learn the technique and do it correctly. Sometimes it takes a time to find the dose that's actually going to work for you. In the office, we'll do a pretty low dose, and then you will slowly increase your dose every time you try the medication until you get an erection that's about 50 to 75% of your maximum erection. And the goal is we want to find the lowest effective dose that gives you an erection that lasts long enough to have sex without risking a priapism. You never want to inject more than every 24 hours. And again, if you find yourself having an erection that lasts over 4 hours, call us immediately, come to the emergency room. Now, these medications come most often from compounding pharmacies for the trimix and the bimix formulations. Alprostadil is FDA approved and available as a brand name product, which can potentially be covered by insurance. Bottom line, what do I want you to take home? Intracavernosal injection therapy is highly effective, time-tested treatment for erectile dysfunction with success rates nearly 90%. It works when pills fail and can be customized. And it's helped so many men maintain their sexual health and relationship for decades. Yes, this idea of an injection might seem daunting initially, but the reality, as we see it in our patients and in the literature, it is far less comfortable than anticipated and provides superior rigidity and is a reliable solution for maintaining sexual function and confidence. If you guys like this video, do me a solid favor. Hit that subscribe button because it is free, zero cost way to support the channel. And as always, remember to take care of yourself because you're worth it.